Welcome to the Child Welfare Funding Opportunities conference call. My name is Hilda, and I will be your operator for today's call. At this time, all participants are in a listen-only mode. Later, we will conduct a question-and-answer session. Please note that this conference is being recorded. I will now turn the call over to Mr. Dean Crocker. Sir, you may begin.
Thank you, Hilda. This is Dean Crocker from the Maine Children's Alliance and Voices for America's Children. It's my honor to introduce our collaborators this afternoon, Cara Baldari from First Focus and Ed Waltz, and the State Policy Advocacy and Reform Center of First Focus, which is funded by the Annie Casey Foundation and the Jim Casey Youth Opportunities Initiative. We are very pleased to bring you this webinar on child welfare finance. It's also my great honor to introduce Carl Valentine, President of Valentine Associates and one of the nation's leading experts on federal finance. Carl brings many years of direct service in public management in New York State. I've had the honor of working with Carl in Maine, where his knowledge established our Medicaid finance system for children's services, and we're once again working on a major finance project here. We have a number of things that we hope you will take away from today's webinar, and I'm just going to summarize briefly what we hope you will learn from today. We hope that first you'll come away with an understanding that maximization of federal finance and child welfare must go beyond 4E waivers. Carl will discuss options under Medicaid and 4E training that do not require waivers and can generate millions of new federal dollars for our priority child welfare programs. These options also offer new opportunities to build collaboration fueled by new resources. We also hope that you will come away with an understanding that advocates must understand that they need to have a strategy for retaining new federal dollars. We'll give you some examples. Last but not least, we anticipate that while we have a significant question and answer period, that some questions will not be able to be answered in the time available. If you are not able to ask your question, please send it to me at dcrocker, C-R-O-C-K-E-R, at MEKIDS.org. And I will tell you that again at the end of the session. I will make sure that your questions get to Carl, and we'll get answers for you. So with that, it's my honor to introduce Carl Valentine.
Good afternoon. This is Carl. It's a pleasure to be part of this group this afternoon. Hopefully I can put some information on the table that you will find helpful. I know that many of you are child welfare advocates, and it's often difficult to understand and get inside the rather complex funding of child welfare that is available through both Title 4E and Medicaid. I'm going to simply ask our host to flip to the next slide where I have just quickly an agenda. We're going to be looking at federal funding for child welfare. We're also going to be looking in particular at the use of 4E and Medicaid, as Dean indicated. Child welfare is a complex business, and many agencies need to be involved, and there are now funding strategies that can help involve them through training. And I want to address briefly the politics to basically protect funds once you have earned them. So that I would like now to proceed to the next set of slides, which simply gives a list of the many federal funding programs that support child welfare. Among those is the Title 4E program and the Medicaid program, which will be our focus this afternoon. On the next slide, we have a focus on what we call open-ended entitlement programs. The beauty of an entitlement program is that there is no fixed distribution of federal funding to the state. All of the money that comes to the state is based on expenditures that the state engages in for eligible services. Under Title IV-E, the Child Welfare Agency is the single state agency, the agency that controls that program. When we move to Medicaid, a very small share of that program Yeah, sorry, don't know what happened. When we move to Medicaid, a very small share of that program involves the child welfare system. And so child welfare does not have the kind of leverage or influence in that program, but it also is a very important funding source. I'm going to spend a little time on Title IV-E. As you all probably know, Title IV-E supports foster care placement and subsidized adoption. It also supports about half of the cost of your foster care kids who would be eligible. And about 3/4 of the kids would be in subsidized adoption, that are in subsidized adoption, are in the IV-E program. IV-E doesn't cover counseling or therapy or medical or educational costs. And on the other side of the coin, if you would, these activities, particularly the therapy, medical, and counseling, are activities that can be covered under Medicaid. The rate of reimbursement for Title IV-E is drawn from the Medicaid program, and it varies by the wealth of the state from 50 to 80% of cost. The lower the income average in the state, the higher the percentage of federal participation. IV-E not only supports the foster care and adoption subsidy program, as well as other kinds of services that we now have for older kids. It's a newer program and a guardianship program. But it also reimburses for administrative costs, which are really the case management costs. It doesn't cover investigation or counseling, but it does reimburse training at 75%, and the proportion of the basic management of the training program. So that IV-E is not only a program supporting foster care, subsidized adoption, but it is also a very strong supporter of case management. One of the interesting things as we move into the administrative area, which is an area that can be expanded, it includes the case management at, as I mentioned, the 50%, but it not only involves the children that are in foster care and the case management they receive, but it also covers case management for children that are at imminent risk of foster care. This would be the children in protective service or children that would be in a FINS or PINS program, programs that are basically supported by the juvenile courts. It also would support probation services or activities in juvenile justice. So that Title IV-E, although having its home in child welfare, can have interagency agreements that connect to these other sister public agencies, which makes, again, a very interesting area for opportunity. I want to spend time on the training part of Title IV-E because that's an area that has some major new opportunity areas. We have both short-term training, which would be considered in-service training for staff and foster parents and adoptive parents, and long-term training, which pays for social work education for students who plan to work in public child welfare or for public child welfare employees who are selected to go and participate in a master's or baccalaureate program. There's a new area that was made available under Fostering Connection, recently amended 4E legislation, that extends training to relative guardians, licensed child care institutions and group homes, abuse and neglect court staff, attorneys on both sides, guardian ad litem, CASA staff, and staff licensed or approved child welfare agencies. And I want to spend a second on this last bullet. Staff in licensed or approved child welfare agencies, that's a term that doesn't exist in federal definitions. It's a area that a state can choose to define, and so that they can include the child welfare partners that might be mental health, it might be public health, it might be school social workers, it could be various organizations in the community that are working with parents or training parents to help other parents. Title 4E, again, provides the 75% federal reimbursement diminished by the percentage of children in the foster care program that are 4E eligible. So on average, the federal funds cover about a third of the total cost of the training. So there needs to be other funds put on the table. Those funds could be drawn from the juvenile court. It could be drawn from other public agencies participating in the program. Part of the challenge is to find adequate match so that you, in fact, can expand training into these new areas. There's a number of ways that states have been very creative in doing this, and I'd be happy to respond to questions in that area. The key, though, is that for the first time, after many, many years, this program was initially set up in 1980, we can now reach out, and there's a recognition that child welfare, to be effective, needs to involve all the players working around a common understanding of where the program is headed, how we work with very high-risk families, and the legal constraints that for part of the baggage that we have to work with so that advocates and others understand both the opportunities to help and also the constraints that the public workers must live within. As we move to build our training, I'm now moving to the universities as trainers slide. The universities have been a major partner. Part of this, particularly the public universities, part of this is because they have both the expertise, but also they have public funding. The public funding supports their professors who can offset part of the match required in developing training. Also, the university has a federally approved indirect rate, usually between 40 and 50%, that can be contributed by the university in whole or in part. Normally, they hold back about 8 to 10% for their own administrative responsibilities, but contribute the remaining, what we would call federal indirect rate value. So if you had a $100 program, by working with the university, the cost of that program is increased to $150, but the federal revenue then that comes in for a $150 program is now about half of the total cost rather than a third, as it would be if the program was done without the universities. The universities can add additional supports so that often nearly all of the cost of the training is provided by the public university. Nearly every state has developed these partnerships. The area that has not had much development would be in the area of community colleges. and they are a very important participant, particularly as we start working with parents and moving to locations throughout a given state. Part of, I'm now moving to the issue of managing the 4E program. To oversee the complex 4E eligibility rules and making certain that administrative decisions in the agency are not made without the impact it might have on the financing, it's very important that the 4E program be tied in at a fairly high level within the Child Welfare Agency, and that the agency doesn't take the program for granted, but rather manages the program with a high degree of vigilance. If that doesn't occur, your eligibility will slip, your overall management of the program becomes sloppy, and you lose revenue that is essential to running the child welfare program. When you're assessing how well your child welfare, I'd move to the next slide calling assessing the child welfare program. When you're trying to figure out how well your state is doing in the management of Title 4E, you want to look at the 4E eligibility rate. If it's below, this means the proportion of foster care kids that are participating and eligible for the 4E program. If it's below 50%, there should be a look at that percentage. 50% is a good percentage, but 20% is not a good percentage. 40% is reasonable but could be better. So that just looking at that one factor, you begin to know how well are we doing with 4E eligibility. It doesn't vary tremendously from the richest state to the poorest state. A second area that we'd want to look at is are homes that we are placing our children in properly licensed. If homes are not properly licensed, if we're not able to claim all of our 4E eligible children because of licensure, that needs to be addressed. And again, it's an area of considerable interest and controversy across the state, across the country, because often the best home may not have enough bedrooms to meet state licensure standards. So that the state really needs to look at and make a clear distinction between what is the safety aspects of licensure and what would become optional aspects of licensure, so that you can waive some of those non-safety issues so that a child can in fact be in the proper foster home and also qualify for 4E funding. Also just need to make certain that when you're claiming, and you can look at a state submits quarterly claims, and if you look at your quarterly claims over 4, 5, or 6 quarters, and they're decreasing, you should be concerned. These are things that can be done fairly quickly, but it gives you some idea of how well our 4E program is performing. This all, from an advocate's perspective, may require asking for information that is not generally shared with the public, but is available, and can help you get a sense of where the program is strong or not quite as strong as it should be. I think I want to end our discussion of Title 4E by thinking about Title 4E waivers. Title 4E waivers are available. A number of states have opted for Title 4E waivers. But the result and the reason they would do this generally is Title 4E, as we said earlier, doesn't cover the kind of wraparound services you'd like to offer a child who you're choosing to keep at home rather than place in a foster care setting, or a child that we'd like to bring home from a foster care setting as quickly as possible, but will need wraparound services so that that child can be successful in the community. the waiver would allow 4E to be used in this wraparound way, more flexible way, rather than simply to pay for foster care or simply to pay for the casework provided by the public worker. But in choosing that, you're choosing to cap the program, meaning to close the open-ended entitlement aspect of the program. And that can shortchange the state over time, as your foster care program may be have fewer children this year than it did last year. But if you look back over a 10-year period, that number of children goes up and down, and you don't want to handicap your program unnecessarily by what we would say capping the program and accepting flexible funds, because it may preclude your ability to expand the program in the future. So that I would recommend, rather than moving toward waivers, to consider seriously using a Medicaid option to accomplish the same thing. Medicaid, and so we're now starting a discussion of the Medicaid program in a very brief way as it relates to child welfare. And then we will move on to simply thinking a bit about how to work with the refinancing of child welfare strategically. Medicaid supports counseling and therapy, but it does not cover educational services. It does not cover investigations. It does not cover that would be part of the child welfare system. It does not cover some of the room and board issues that are clearly foster care. So that by partnering the two, you basically are offering a wraparound approach. Another beautiful thing about Medicaid is that nearly all the children in foster care are Medicaid eligible when under Title 4E. Only about half of them are 4E eligible. So immediately you have federal participation for all the children that are receiving a Medicaid service, whereas you're only getting federal participation for half of that group under 4E. Medicaid case management also has a service reimbursement rate, which, again, as I had mentioned earlier, floats from 50 to 83% for, depending upon the wealth of the state. So you're getting a larger proportion of your dollar expended would be coming back to you than if you use Title 4E as an administrative cost at the 50% rate. So that generally when you would be thinking about Medicaid, these are the variables that kick it into a much higher return, but also there are risks associated with Medicaid. I want to talk about two programs in particular in the Medicaid program. One is targeted case management. The targeted case management program serves both children in foster care and children in protective services. It provides a case management service that addresses medical, social, educational, and other needs. It's very broad. It includes assessment and case planning and case management over time. It does not include medical, educational, or direct social services. So it's a lot of what the public social worker does, but not everything that the public social worker does. And so in running Medicaid with 4E, 4E covers part of the activity, Medicaid covers the rest of the activity. Your child welfare worker is the case manager under your targeted case management program. We don't need fancy credentials. There must be a state plan that identifies the target group and the services to be provided and who the providers are, and offer a rate methodology. The way you get started is to simply decide the scope of the program, how you're going to turn that service on, how the child's service plan will in fact state that you're offering a targeted case management, who are the credentialed individuals who can provide this service. Generally, it's your child welfare workers. And usually it's billed on a monthly basis. You must have one targeted case management contact with the particular child in a monthly period. There are some issues that you have to think about in designing targeted case management. You want to make certain that you limit your program to eligible providers. This would be your public child welfare protective service workers. You want to make certain that the parents have a choice of who will be their case manager if you're going to move the program into a protective service. It's not a freedom that many parents choose to exercise, but it needs to be in your program. You want to make certain that you're not duplicating your services so that your case management and the case management, let's say, that might be provided through mental health for that same child are not overlapping, and when they do overlap, that the service has been coordinated so that Medicaid only pays once for case management. You want to be able to adjust your rates. You may get a great rate the first time out based on cost, but the Medicaid agency, being huge, may not want to adjust that rate each year thereafter. It should be adjusted, and that can certainly be taken care of in the interagency agreements that would be signed that would enable child welfare to offer a targeted case management program. The child welfare agency provides the match. The Medicaid agency would not be happy if they were asked to provide that match, and the child welfare agency needs to have a claiming mechanism that's very much like the claiming mechanism that you use in the claiming of foster care services. If it's done right, targeted case management can increase your federal funds by about 50%. And I've seen this occur over and over again in child welfare agencies. The last program that I want to talk about is the Rehab Service Program, and this is a treatment service. Most states have it. It provides intake assessment, development of a plan, services, living skills development, counseling, therapy, crisis intervention, consultation. Again, it's the kind of thing that community mental health provides, but we're bringing it over to child welfare because child welfare has a different approach to, and often has a different target than community mental health. And if they have these services directly involved with their providers and their families, they can shorten length of stay, reunify families sooner, and strengthen the success and better outcomes for their kids. The way to move into this is either for the child welfare agency to have a state plan that makes them the sole provider of rehab services. I've generally done this through an interagency agreement as well as a state plan amendment, so that the child welfare is the only provider in this particular system, and that this system basically has its rates based on cost. This can be accomplished through an arrangement with the Title IV Maternal and Child Health Program, which, again, you're thinking, why MCH? MCH was set up as a partner and as an integral part of Medicaid at the beginning. They're a privileged organization, and anything that maternal and child health does either by themselves or in partnership with another public agency has the benefits of being it's like an in-state waiver that allows you to have selected providers, cost-based rates, a bundled per diem, and a program management that is self-contained, if you would, within the child welfare program. States that have opted for this, the biggest flaw has been getting the private providers to adequately document the services that they provide in group care and non-medical residential facilities. A number of states have also used this for wraparound. Again, the rehab option is complex, but has tremendous advantages. And so as I now summarize this very brief overview of federal funding, what you're constantly trying to do is increase revenues, make certain that the revenues that come in are used for enhancing and strengthening programs for children and their families, and that you weigh the advantages with the risks so that when there are risks, you walk in knowing what those are, and you try to have a monitoring system in place that gives you feedback so that you can tell at the management level within the agency how well you're doing. Some of the immediate opportunities, targeted case management and rehab are huge undertaking. The immediate area of opportunity I would recommend would be in the area of training and fostering connections a reality in your state. Very few states have done this, where you're partnering with the juvenile court, partnering with your advocate agencies, and basically developing a training program so that everyone that's involved with child welfare are being cross-trained in common training experiences. This, to me, is a very exciting opportunity and one that many states are now needing to step up and think about how to implement. Those are the thoughts I have. I know I covered a lot of space here, a lot of ground very quickly, but I look forward to questions.
Thank you. We will now begin the question and answer session. If you have a question, please press star and then 1 on your touchtone phone. There may be a delay before the first question is announced. If you are using a speakerphone, you may need to pick up the handset first before pressing the numbers. Once again, if you have a question, please press star and then 1 on your touchtone phone. We have a question from Gail Johnson from California. Please go ahead.
Thank you. We're using some of these methodologies to be able to continue some effective pilot youth permanence programs. But part of the challenge we have is that we have to cross different departmental funding silos to get the local match. Do you have any suggestions on how to work effectively across departments when it's not necessarily child welfare?
Yes. Let's think about creating a funding pool in one of your public agencies, and so that both private and public agencies could contribute funds, let's say, to your state university system, where you're going to get the largest kick because everything there would be built around and added to by the use of their federally approved indirect rate. The other opportunity, let's say you're offering the training, let's say it's 4E sponsored. 4E is quite broad, but it has some limits, so that you could blend your funding, as we do in Kentucky with Medicaid and 4E together, so that we take a look at the curriculum and say about half of this relates to Medicaid stuff and about half of it relates to child welfare stuff, and so we charge each about 50% of the cost. Again, as various agencies come and sit in the classroom, their salaries, if they're coming from public agencies, can be used as match. We're using that extensively in Vermont and in other states. And we're looking at some interesting ways of using the juvenile court in Louisiana so that their 4E federal funds are used to support the non-4E portion. Let's say if you have 50% of your kids are 4E, the other 50% can be paid for through federal funds or any other funds that you have, foundation funds or whatever. So that what you're doing is really thinking creatively about the resources that you have and drawing on 2 or 3 funding streams so that each program feels like they're getting a fair share. And again, the various funding streams need to sign off, but once they sign off, the billing is automatic, if you would. Does that help at all? Gail, I don't know.
It does. Specifically, we're using EPSDT funds to do activities to help teens achieve permanent families. So it's the Medicaid match piece that we're looking at, not training. So I'm assuming what you said applies there.
Absolutely. Yep. So again, you need to be able to have a way of bringing that match forward, and if it's in a public place, because the funding for any Medicaid or 4E must be public, under public authority, but private agencies can contribute to a fund, and they don't have control over how that fund is spent, but the next year they don't have to participate if they don't like the way it was spent, so that the manager of that fund is certainly going to take their interest into account. So that I've found that that is not a difficult way, once it's in place, of getting some interesting funding that can support an initiative.
Okay, so the private can contribute as long as there's not strings attached to how it's used.
It can be, the strings can go for the purpose, but not for the particular vendor who would benefit from that purpose.
Yes, that makes sense to me. Okay, thank you for that.
Thank you. Our next question comes from Rob Farkas from North Carolina. Please go ahead.
Okay, this is Lisa Sprouse in the room with Rob. Can you utilize 4E funds on a child that we do not have custody of? However, we're working with juvenile court in attempts to prevent placement.
Yes. The answer is, let's assume that you have a CASA working there. Let's assume you have some preventive services working. You may even have an open protective case.
Yes.
To the extent that you have that case open, the child's plan needs to say, absent the provision of preventive services, this child is at imminent risk of foster care. As long as that language is in the case plan, Title 4E, you'll participate in the, again, let's assume you have $100 of expenditure, and let's assume that half of the kids in the state's foster care program are 4E eligible. So that $100 would be multiplied by the 50%, and you would then get a 50% federal participation, so that for every dollar that you spend, you would get 25 cents in return for that preventive service that you're offering.
Okay.
Does that make sense? I'm sorry, I went through a lot of steps. But
yeah, it's very confusing. And so we would, on a kind of a down and dirty level, we would, what we use in North Carolina to access monies is 4263, where we put a kid's name down. They have 11-digit ID number. Then would we code that kid to 4E?
Right.
Okay.
And now, what happens then? All right, you code the child to 4E, but the issue would be: does the child have in the case plan language that would establish the child as being at risk of foster care? Once you've done that, you're inside the 4E world, if you would.
Right. Okay.
And do they have to be open for protective services, or could it be a voluntary?
It could be voluntary. It could be a PINS. It could be a FINS. It could be in a juvenile program. Again, for this to work, the Child Welfare Agency needs to have an agreement with their partner who would, in other words, if the juvenile court had that agreement in place, the juvenile court, as they do in Louisiana, could claim for such children, could also claim for the training offered to CASA workers. Again, but you need to have the linking back to the single state agency, which is your public child welfare agency.
Okay, and the language is the key.
Yep.
In the case plan.
Yep, that's a very important part of, and the state needs to be willing to go forward with that, but that is an accepted way, and they have, there's clear guidance in the federal child welfare manual on how best to do that.
Okay, thank you.
Thank you. Our next question comes from Claire Roshenko from Florida.
Great.
My question was really just, is it possible to get a copy of the PowerPoint presentation?
I'm sure we can do that. I have to flip back to our sponsors and see if we could just ship it to you if you can give us your email address.
Sure.
Yeah. Hey, Claire, this is Ed from First Focus. We'll be sending around a copy or a link to the PowerPoint after the webinar to anyone who registers.
Okay, wonderful. Thank you so much.
Great. Thanks.
As a reminder, you can press star 1 if you have a question. The next question comes from Linda Hall from Wisconsin. Please go ahead.
Hi, Carl. I've got a couple questions here. One is that you mentioned, both in terms of rehabilitative services and in terms of training, you mentioned that there were some states who are really doing some creative things there. Is there a way to get a list of those from you?
Well, it depends how you define creativity. In terms of training, Linda, it would be the work that I'm seeing is really where states are reaching out to their advocates and their sister agencies like mental health or special ed, school teaching. In other words, and attorneys, both attorneys representing the kids, attorneys representing the parents, attorneys in the public agency, judicial staff that have really never been trained in the same classroom with the child welfare worker, at least rarely. So that 4E welcomes this kind of training. The training would need to be described in the Title IV plan, which is the child welfare plan, and the curriculum needs to be one that would be of interest to the participating parties, so that you'd want to get some kind of cross-system planning underway. But it just really opens up at currently a 70% FFD, that'll be effective in October 1st. Right now it's 65% federal participation, 70% federal participation. If you do it with a public university, they kick in so that a good share of that training can be supported by the university, and the remaining share can be put on the table by the participants, so that both the provider and the students in the classroom can contribute to the overall funding of the program. Because when a public, or let's say a probation officer attends, or a court officer attends the training, they are public salaried individuals. The value of their salary and fringe benefit during that one-day training can be contributed as a non-federal share, which in turn can be used to draw down the federal funding.
Okay, that's helpful. Can I ask a follow-up question? You answered some questions about whether juvenile justice children at risk of foster care could be, if 4E could be used for some services for them. Are you aware of any states using this to serve homeless and runaway youth? I'm thinking especially of unaccompanied teens.
Okay, the issue there is, would this youngster be considered at risk of foster care absent the provision of preventive services? And so that is the key. I think the 4E has difficulty moving into territory where the risk factor is not has not easily established. But I would think the PINS designation, as many of these kids, child in need of supervision, or FINS, family in need of supervision. Again, that's working with your juvenile court with these high-risk kids, could qualify. But typically, some of the children in that group would be have school attendance problems and would not be at risk of foster care. So you'd have to cut into that population and simply begin identifying what proportion. If your proportion drops below 15 or 20%, the federal return, the work of getting federal return is not worth the benefit. If your population would be higher, let's say 50 or 60%, the return would be great. So it's certainly worthwhile if you're working with a population of what I would consider high-risk kids.
Okay. Thank you very much. Helpful.
Thank you. Our next question comes from Kim Stevens from Massachusetts. Please go ahead.
Hi. Thanks for taking the question. Carl, I was just in a meeting today, and it was stated in the meeting that it costs more for my state to draw down certain federal dollars than the actual dollars that they would draw down. And I just really have a hard time believing that's so. Is there a situation in which that would be so, that it would be more expensive to try to get the money than to get the money itself?
Only in the situation that Linda had just mentioned from Wisconsin, where the proportion of young people was such a low percentage of your population group that Title IV would not consider these kids at imminent risk of foster care absent the provision of preventive services. So that what you want to do is look at the group of population that you're looking at. Is it a fairly substantial proportion of high-risk kids? And then there's absolutely no reason to shy away from these entitlement funds. Once 4E is in play, and let's assume you're running a 4E program for child welfare, and there's a very tight, how can I say, their staff has been cut, and to develop a new agreement with juvenile court, they might view as being an inordinate administrative challenge, task, whatever, and they may shy away from it. Once that agreement is in place, funds can flow, and so sometimes if you can bring in someone who could work with you to basically design the system so you're not drawing heavily on their staff, they may be willing to move forward with 4E funding, or they may be willing to move forward with Medicaid funding. There's very few situations involving high-risk kids where it isn't worth going after Medicaid or Title IV-E. It's not the total dollar. It generally will pay for about a third to a half of the cost, knowing that you have to come up with the other half. But that's huge because you can often save state dollars or other what I'd call block grant, like SSBG money, and make better use of very, very tight, very limited dollars. All you're really doing is trying to build the pot of available dollars to serve high-risk children and their families.
Thanks very much.
Yeah, you really cannot turn away from entitlement funding without having at least on the test and they're saying to you basically the juice is not worth the squeeze.
Yeah.
And I would basically challenge them, particularly if you're dealing with a high proportion of Medicaid-eligible children or a high proportion of what I would consider high-risk children.
Thanks a lot. That's helpful.
Our next question comes from Amy Galvano from Washington, D.C. Amy, your line is open. If you are using a speakerphone, you may need to pick up the handset. Or if your line may be muted as well. We're not getting a response. We'll move to the next question. As a reminder, you can press star 1 if you'd like to ask a question. We show no further questions at this time. Oh, I'm sorry. We have Amy Galvano back on the line. Amy, go ahead.
Hi, this is John Germana, actually with the National Foster Care Coalition. I have a question in regard to the 4E training based on the paper. How limited is the 4E training in terms of, I heard an interpretation once from regional staff about the training, even for like a CASA, was limited to determining 4E eligibility.
Whoa. Someone's smoking something. 4E is wonderful. It has, the training is available in anything that relates to foster care or children that are at risk of foster care, so that the range of eligible topics are mentioned in the Child Welfare Manual. They're extensive. It's virtually the entire social work curriculum at a university is allowable. So think of everything that you can think of in a child welfare curriculum, a master's or baccalaureate program. Those are all 4E allowable. It's so that in essence you're able to draw 75% times the percentage of your 4E eligible children in the district or in the state. And that percentage applies to all facets of training. So you're moving into a CASA. What is a CASA? These are all volunteers appointed by the judge. What are you doing? You're training them. You're training them initially. You're training them ongoing. Most of what happens in CASA is training. So that instead of using court dollars for your CASA, you can use 4E covering about half the cost of the program. So you could double the size of CASA tomorrow if it was connected with 4E. And virtually no CASAs in the country, other than in a couple of states that I'm working in that I know of, are currently funded by 4E. So it just the opportunities here are huge. And I would urge you to reconsider the opportunities for training.
Thank you. We'll go to the next question. It's from Todd Lloyd from Pennsylvania.
Hey, Carl. Really curious to know about any strategies that you have for us regarding negotiating with ACF on our base of 4E. If we were to apply for a waiver, what are some of the things we should be thinking about and looking at in determining what that base is?
Okay, you're moving toward a waiver structure. You want to, I think, pick a target that doesn't cap your entire state program, but simply takes a chunk of it. I would normally begin with a group like children placed in foster care by the courts under child welfare supervision. These are usually juveniles. Most of them have families. They could be brought home. If you look at length of stay, usually their length of stay is much longer than you'd expect. And you could make a huge difference if you offered a wraparound program for that target group. So again, what you want to do is pick a selected group within your state that you really can make a difference. If you look at the waivers that have been used in Title IV in their first round, very few of them made significant differences. The results were rather disappointing. And so you really have to move in with a fairly focused strategy that can, in fact, make use of flexible funds as they have in wraparound Wisconsin, as they have without use of the waiver, wraparound Milwaukee, as they have in some other beautiful wraparound programs where you take a target group and really do it right. But then you're also picking perhaps a geographic target within the state, and you also may be picking a set of providers who are able to offer a full range of wraparound programs and are really committed to improved outcomes. You may want to use a performance contract methodology that really rewards those who are able to make a difference. I'm not hitting your question perhaps as square as you'd like, but I think look at your waiver work. The state of Florida has done some excellent work, several others, and see which of the demonstration projects you like. You can find a good deal written about them on the web. There's a couple of publications that have been put out within the last several months that are excellent. In particular, they mention Indiana, Florida, and Ohio as being states that you should at least be aware of what other waivers in the country have achieved and what they have not been able to achieve.
Thank you very much. We'll go to the next question. It's from Susan Hamill from Connecticut. Please go ahead.
Hi, Carl. I just wanted to bring you back to a training question again. Are you experiencing, or do you know of any other states having difficulty with challenges on the training costs in terms of the 75 versus the 50%, with an examination of the initial in-service training versus ongoing, the amount of caseloads that the workers are carrying, that sort of issue?
Sue, it's great. I'm glad you're working in Connecticut. Training is tough. It's very broad. There's very little, but again, the Child Welfare Manual identifies some things. For example, CPR training that would be available to everyone as being not a 40-75, but rather a 50% training activity. But most of the activity, certainly all the activity that you would be giving to your caseworkers or your foster parents or your adoptive parents would be training that could be framed as 40 eligible activity at the 75% level. So that I don't know why. I mean, we just negotiated this up in Vermont, and Vermont got their entire plan approved. The audit, tried to knock them down and couldn't. They've done a beautiful job there, and so you might want to just look north to the Vermont training, the scope of operation run by Gail Buford at the University of Vermont.
Gail Buford?
Yes. In cooperation with the state agency.
Okay.
Again, you're all operating under a Region 1 sort of framework, so you should have common rules. There's tremendous differences as you go across the country, by the way, as to how the regional office views various issues. So you really have to look at your sister states in your federal region to understand some of the nuances of what's allowable and what's not allowable.
Okay. Thank you very much.
That was our last question. Do you have any closing comments?
I can only say that advocacy is clearly very important in our child welfare world today, and being able to move in and be effective in the area of training and in the area of service by trying to encourage your state to be a little more creative in using federal funds, I think in the end will help children and their families. Often state agencies are so worried about an audit exception that they freeze, withdraw, and become a much smaller operation than they could or should be if we're really talking about helping kids.
Great. Thanks, Carl. This is Ed from First Focus, and I want to say thanks to you for a great presentation, and thanks to Dean Crocker as well for connecting us with Carl and for working with us to bring this analysis in this webinar to all of the advocates on the phone. Dean has also generously volunteered to collect any questions that folks were not able to ask during the webinar today for Carl. So if you have a question that you were not able to ask during the webinar today, please email Dean Crocker at dcrocker@mekc.org. DCROCKER.org. That's DCROCKER at Amazon Mary, E as in Edward, kids.org. And then lastly, thanks to everyone who called in and to Hilda, our great conference operator, for a good call.
Thanks. Take care.
Thank you. Ladies and gentlemen, this concludes your conference call. Thank you for participating. You may now disconnect.